Hello, my name is Iva Bužančić. I am a community pharmacist from City Pharmacy Zagreb in Croatia. Today's session will provide some insight on how pharmacists support patients in self-management of common ailments. An average community pharmacist, besides dispensing and counseling patients on use of prescription medications or compounding medication, spends a lot of time helping patients manage common ailments. Most frequently, we counsel patients on self-management of sore throat, which used to be more of a seasonal problem during autumn and winter, but now we're seeing it year-round due to increased allergies, increased use of air conditioning, viral infections, which are now going year-round, and a lot of air pollution. So counseling on appropriate self-care is a very big component of everyday work for a community pharmacist in Croatia, but I believe this translates to pharmacists around the world as well. Generally speaking, pharmacists have a very versatile role as a supportive healthcare provider when it comes to effective self-management of common conditions. On one hand, it's important to recognize and identify symptoms. On the other hand, it's important that we consider different patients' determinants, which can then affect effective and successful self-management of certain conditions. And when it comes to sore throat, recognizing and identifying symptoms, it's all about asking the patient the right questions at the right time. What is the onset and duration of symptoms? What's the severity of symptoms? Do patients are experiencing symptoms such as postnasal drip, pain when swallowing? Is it allergy season? Is it viral infection season? It's all about recognizing red flag symptoms, which should not be self-managed and require further attention from a physician, such as are patients experiencing high fever and chills alongside with symptoms of a sore throat? Are those symptoms lasting for more than 7 days? Are patients experiencing general malaise, joint ache, ear ache? Is this maybe a reoccurring problem? Are there any changes in the quality of voice of that certain patient? It's helping patients choose the right medication, non-prescription medication, keeping in mind their past with their current conditions and their pharmacotherapy. Do they have any allergies to analgesics or anesthetic that could be used for management of sore throat? Are there any possible interactions with chronic medication they're using? Is our patient maybe a child who would require different medication formulations? It's also very important that we work together with the patient to create a plan of care that is patient-centered, and it's teaching patients how to recognize symptoms and conditions which can then self-manage in the future, especially, let's say, if you have a patient who is using their voice a lot, how to prevent vocal cord exhaustion, and how to maybe differentiate vocal cord exhaustion from your regular sore throat due to a common cold or a different viral infection. It's also teaching patients the importance of preventing overuse or misuse of non-prescription medication. It's also considering when to recommend non-pharmacological measures and when to maybe recommend some non-prescription medication. Whether or not maybe just rest and fluid intake will be enough, humidifying the air, avoiding irritants in the air, preserving your voice and not talking will maybe be enough for certain patients. And we have different clinical scores and criteria such as Centaur, McIsaacs, or McFever or fever pain, which can then help us navigate and during our consultation with the patient. Considering important patient factors or determinants is also very important to keep in mind. It's finding a financially appropriate solution for a patient who has limited income, such as suggesting gargling a salt solution or using honey or other home remedies. Instead of buying lozenges or sprays, it's suggesting and adjusting non-pharmacological measures so that they comply with patients' personal cultural background and health literacy level. We have different types of leaflets, drawings, diagrams. There are a lot of digital apps that a lot of patients like to use, which could be then helpful when we want to create a list of steps for self-care for a certain patient. And finally, it's suggesting lifestyle changes for better and long-term symptom control, especially for those who are, let's say, smokers, those who are using their voice a lot, those who are maybe experiencing acid reflux as well as sore throat symptoms. For pharmacists, it's really all about finding a balance for your patient and empowering them to take a more proactive role in self-management of their health. Pharmacies need to be an open and friendly space where patients feel comfortable and they know they will get an evidence-based advice for their condition. In my country, a lot of patients are accustomed to visiting one of the same pharmacies and pharmacists and generally consider a certain pharmacy or pharmacist a part of their family healthcare providers, and they visit the same pharmacy for generations. And pharmacists always need to use a holistic approach when caring for their patients, which really helps in gaining loyalty. It's remembering patients' conditions, pharmacotherapy, taking into account their social, financial, or physical determinants. It's being open and honest about your recommendation. If a certain medication or supplement is not necessary, is not effective for management of sore throat, patients will value and respect that kind of information. And it's reassuring your patient that sore throat is a self-limiting condition and it will pass within a couple of days is also very important. If we are looking at a more wider picture, pharmacists reaching out to their communities, creating public health projects or initiatives to familiarize patients the ways they can manage common conditions is also important. In Croatia, we had a lot of initiatives where pharmacists visited kindergartens and schools and discussed with young children about appropriate and timely use of antibiotics, hygiene measures during cold season, and that created that very important first contact with a healthcare provider such as a pharmacist. Pharmacists are often the first and the last link in a patient's health journey. And when we see a patient complain about a certain problem, it's all about triage, recognizing symptoms which can be self-managed and recognizing those symptoms which are red flag and require further attention from a physician. Pharmacies have different clinical criteria they can use, such as Centaur score, McIsaac score, or fever pain, when differentiating between a sore throat connected to a viral infection or that could be a possible strep throat. And when there are red flag symptoms, it's about reassuring our patient to visit a physician to make sure that they get appropriate care. And recently, during drug shortages, that physician-pharmacist communication and collaboration became even more important. Communicating with your fellow physicians about drug shortages, what is available when it comes to prescription and non-prescription medication, what kind of antibiotics due to antibiotic shortages we have available, and of course, what we can do when we have shortages of paracetamol or ibuprofen in children's formulations. Pharmacists have a lot of positive impact on fellow colleagues when it comes to professional development in any area. And it's also actually one of our duties as healthcare providers to continuously work on our skills. And when it comes to skills that we need for teaching patients or advising patients on self-management, I find that everyday discussion with colleagues about cases that we encountered or possible solutions can be a good incentive for a coworker who needs to maybe freshen up on guidelines or who needs need help with advancing certain soft skills to be even more effective in self-care counseling. And it's also very vital to encourage one another to continue professional development through trainings, graduate professional courses, webinars. We have a lot of tools that can help us and manage and improve our skills. And in a lot of pharmacy chains, including one where I work, we have educational in-house activities to help us keep updated on all important aspects of successful patient counseling. And finally, it is very important to exchange information, both with fellow pharmacists, but also with other healthcare providers on how to approach patients, on how to effectively solve problems, and finally, how to actually increase patient satisfaction with the services that we provide.